Pan-African Association of Surgeons meeting with the African Union Commission. Now, this is the first time that the Pan-African Association of Surgeons, which is an association that covers the whole region of Africa, meaning the subgroups of the sub-regions like the COSEXA, which is the College of Surgeons of East Central and Southern Africa, and the West African College, and the ones in Central Africa, all come together under the Pan-African College of Surgeons. And we were meeting the African Union and having this meeting here at the African Union headquarters because the issues of essential and emergency and essential surgery are issues that are embedded in the SDGs according to the resolutions that the member states have passed at the World Health Assembly and also at the UN through the SDGs. Now, we know that the African Union has recently started taking on responsibilities and playing a big role in health. Now, as you know, there's already the setup of the African CDC that was just launched. So for us as surgeons in Africa, we are interested to ensure that as we prepare our health systems, strengthening them and preparing for the primary health care and universal health coverage, that all aspects of healthcare are taken into account. And as you know, surgical services are very, very important, especially if they are provided close to the people, which is at the district hospital level. So this is the narrative and the discussion that we've been having here. And the goal of the meeting is to discuss these things so that we are all at the same page together with the African Union, and then to work out ways in which we can work together towards achieving universal health coverage for our people across the whole continent of Africa. This meeting also presented an opportunity for sharing of best practices because many countries are already moving on this work through preparation of their national surgical plans. Ethiopia is a great example that has shared with us what they have done so far and what they are doing, and of course the challenges they have faced so that other countries that are starting up cannot face this challenge. And from this meeting at the end, we should have a roadmap on how we can work with the African Union and all the stakeholders that are present. Everybody has been represented here. The South Africans are here, the whole COSEXA is here, the West Africans are here. So the whole team of African surgeons and anesthetists and nurses are here to have this meeting, and we want at the end of this meeting to work out a roadmap on how we're going to support the African Union and also work with the African Union using that platform to ensure that this thing gets to the people and we can deliver good services to our people on the continent. So that's what the meeting is about. I myself am Emanuel Makasa. I come from Zambia. I'm a health diplomat and I'm a surgeon myself, but I work for Zambia at the United Nations in Geneva, and I deal with health. I am the one who was behind the adopting and negotiating the resolution on essential and emergency surgical care and anesthesia. So I have a lot of personal interest in this work and also professional interest, and I have a key role to play in this meeting and many, many meetings that address global health, at least for the continent of Africa.